and you never had cancer, you've not died. I'm not sure why you have not died from a chronic disease yourself, because you've been taking these vegetables and leaves your whole life. So hello lovely viewers, it's your boy Prince again on Herbal Alchemy. Yeah, so it's another week here. So I'd like to talk about 5 most important reasons why herbal medicines should not be for you. Stay tuned and let's get on to the business of the day. So I know there's a lot of information flying here and there. There are a lot of people are now trying to go the natural way. They are trying to use herbal medicines more. They are saying herbal medicines are safe. Some are also saying herbal medicines are doing a lot of miracles, signs and wonders here and there. Well, there's a lot of truth in that here, but there are also very important reasons why herbal medicines might not just be for you. You know, it's not for anyone. So to begin with, herbal medicines are not suitable for people who are on other medications. You remember the last time I explained that herbal medicines contain a lot of compounds in there. I explained that most of the time it's just 1 or 2 compounds in there which is working potentially to give the herbal medicine its identified effect. And most of these herbal medicines on the market do not just contain one plant, but they contain several. So now we have a lot of compounds in the herbal medicine ready to mingle. And if you're on any other medications and you start taking herbal medicines in addition, it is a recipe for disaster. And that is 3 things can happen. Either these compounds in the herbal medicine end up nullifying or reducing the effect of the medication you are taking. Either it enhances or intensifies the medication, which may or may not be the best, or it might end up producing effect which might be life-threatening. That it might be causing harm, that is adding to the growth and development of a chronic disease that you may not know of. And nobody wants to deal with somebody or something whose actions or intents cannot be predicted. It is too much risk. On the extreme side of things, these herbal medicines can be taken when they are vetted and approved by your health specialist, your physician, or a medical herbalist. And so taking a herbal medicine may not be suitable for people with serious health conditions. That's people with kidney and liver disease. So basically, the liver just breaks down drugs and excretes these broken down drugs and toxins that are produced in the body. The kidney also does the same thing. It degrades and removes medications from the body. So when these organs are not functional, medications tend to build up in the body and they cause a lot of harm. I think you know where I'm going with this. So when your soldiers, which help detoxify and flush out medications from your body, are not well enough, you should think about it when you are taking in herbal medications. This is because herbal medicines contain a lot of compounds and you will be dealing with a lot in there. But yes, I know people who say they intend to or they are taking in herbal medicines because these herbal medicines are going to revitalize or strengthen their kidney and their liver. But on the extreme side of things, unless it has been vetted and approved by your health specialist, your doctor or physician, or a medical herbalist. Now, one other point is when people are going to have surgery. So it's important to tell a doctor if you've been taking in any herbal medicine if you are to undergo surgery. So this is because some herbal medicines might interfere with the anesthesia and other medications before, during, or after the procedure. So to talk about anesthesia, when a patient is supposed to go through a very painful procedure, he or she is just subjected to medication, thereby making the procedure very pain-free. That is anesthesia. And this is the situation where you don't need to be taking any herbal or any other medications before a surgical procedure takes place. Some herbal medicines may interfere with blood clotting or blood pressure, which may increase the risk of bleeding during or after surgery. So your doctor may advise you to stop taking any herbal medications in the weeks leading to your surgery.
Another one.
So this category of people I term as the category of being. So it's a pregnant woman, a breastfeeding mother, a very young child, and an elderly person. So talking about pregnant women or breastfeeding mothers, they are taking care of human beings who are now developing. They are developing new organs, they are developing a whole state of being. Pregnant women who take in medicines or herbal medicines in general transfer some of these medicines to their babies in the womb, and this might affect the development or the normal process in the baby's development. Everybody wants normal, healthy babies. So think of it when you are going to take herbal medicine. And when the baby is already delivered and you start taking herbal medicines, you end up transferring some of the medicines to the child through the breast milk when you are breastfeeding it. These fresh bouncing babies do not have fully functional liver and kidneys to help break down and pass out these medications or compounds when they get into them. So please think about your baby when you are taking or you intend to take in herbal medicines. Children generally have less developed immune systems or these vital organs which break down these medications. So generally, you are not treating the child, you are harming the child. And for your information, as with all medications, herbal medicine should be kept out of sight and reach of children. So to talk about old people, we know a lot of these old folk have a lot of chronic disease, and most of them have failing or weak organs. And if even they are not diseased, their organs are not as strong as they used to be. Unfortunately, because of illness, our old folk take a lot of medication than any human beings. So generally, let grandpa rest or let grandma have some peace of mind, because we are shortening their life. On the extreme side of things, unless it has been vetted and approved, I like saying this word.
Come on now, dog. Come on, man.
So on the extreme side of things, unless it has been vetted and approved by a health specialist, a physician or a medical herbalist, you should not give herbal medicines to older people. And lastly, one very important point: herbal medicines are not intended or suitable for unbelievers. So let's look at this. To what benefit is communion to a non-believer or a non-Christian? I mean, he or she is just taking a snack. It does him or her no good. Herbal medicine is no good for you. Yes, you. Now I don't know how you've been trained, or I don't know how you've been led to believe that herbal medicine is causing more harm than good. But I'm here to tell you that you are right. Yes, you are right. Herbal medicine is not for you. It is causing more harm than good. You know, you've been eating dandelions, cabbages, roots, a lot of salads, tomatoes, a lot of fruits and vegetables all your life, and you never had cancer. You've not died. I'm not sure why you have not died from a chronic disease yourself, because you've been taking these vegetables and leaves your whole life. Guess what, your friend, relative, or maybe patient who just started taking in bitter leaf, and it turns out he has cancer, and then you all jump to the conclusion that it is the herbs he's taking or the herbal medicine he has started taking recently that is causing the cancer or that is causing the chronic disease that he has. If it is not for you, it is not for you. If heaven is not your goal, don't mislead people. So like I've been saying, speak to your health specialist, your doctor or pharmacist, or a medical herbalist before you try to take in herbal medicines, especially when you fall in between these groups that I talked about.
What is he doing?
He's beginning to believe.
That one there was a violation. Personally, I wouldn't have it.
So did you get any insight? Let the world know in the comment section. And if you have any other reasons why you think a lot of people do not need to take in herbal medicines, you can also let us know in the comment section. You can subscribe if this content are your type of content, and if you want to know more about herbal medicines, I'll be back with another video. Stay tuned.